All right. I've worked with a lot of pediatricians, really good functional medicine pediatricians who are, the term we used to use, and I'm hoping we get to start using different terms soon, was that they were freedom friendly or they were vaccine optional. So they didn't force vaccinate their populations. And just as a preface on that one, the ones that I was working with that I talked to told me that they were giving up between $200,000 and $400,000 a year by not force vaccinating all their kids, because that's what the kickbacks that they were not receiving were worth. So just as a little heads up on that one. So the things that we were doing to prevent autism were obviously not vaccinating. But those who chose to vaccinate, one of the things that we were always doing was making sure that the kids weren't sick to begin with. Lots of times it was, hey, when your kids are here, might as well get them a vaccine. If they're in there because they're sick, their immune system's already down. This is not a great idea to start injecting people with things that require an immune system to function to do. So make sure they're not sick. Obviously, the Tylenol things has been a big thing. We've known this for a very long time. The fact that pediatricians were still being told to do it kind of tells you what the purpose of these vaccines really were. Obviously not that. Now, the big one is, and this gets into the new drug that they're going to come out and they're going to push to help. It's folic acid. The drug they're pushing is folic acid. I can't remember the name of it. It's Livin something. Anyway, it's folic acid. The problem is that it's not going to help very much, because the number one group of people who are being damaged by this have MTHFR deletions. MTHFR mutations are genetic mutations where the body doesn't move folic acid to L-methyl tetrahydrofolate like it's supposed to. So this isn't going to help much. What we need to be giving these kids would be the supplement version, the L-methyl tetrahydrofolate, the fully methylated form of folic acid, because that's the issue. They can't fully methylate it. So I don't see the big benefit from this new drug that they're pushing. I don't think it's going to help much. But we would make sure these kids got all of the methylated folic acid. We'd also make sure they got all the methylated B6 and all the methylated B2. Make sure we got the omega-3 fatty acids. These are the chemicals your body requires to have the brain function. We would also push high fat. We push for these, hey, moms, if you can breastfeed, please do. And we would start stripping out all of the toxic chemicals they got in them, which is mostly from your baby food, by the way. If you look at the dyes and the chemicals and all the trash that's in baby foods, it shouldn't be very shocking to anybody that those things are highly toxic. A lot of times we'd have to get special formulas made, goat milk formulas, camel milk was another really good one that we used. But the foods are also toxic. So that was the other big thing, was, removing the toxicity from these kids. Now, here's the big thing, and I talk about this all the time. If we can get mama clean, kill the parasites, kill the yeast, restore the probiotic function, feed the liver, clean the kidneys, get the body to detox properly before or, sometimes during the pregnancy, and then fill mom with all these nutrients, all the minerals, and all the things that her body and your baby's body require to grow and develop, we don't see these issues. Because when these issues occur, it's because the body runs out of nutrients versus toxins. As soon as that nutrient versus toxins level gets shifted, that's when everything bad starts happening. So a lot of times we'd use a lot of minerals, but with these autistic kids, we'd have to use transdermal stuff that would go through their skin. So, you're using B vitamins, you're using minerals, you're using things like that on the skin to penetrate in and help kind of get these kids back where they're supposed to be. But obviously, stop vaccinating. Like, once the poison's taken effect, you're good. Stop. That was obviously one of the more difficult ones. The thing that was really bad was when you would talk to parents and they would bring these kids in and they were like, yeah, the kid was totally fine. And then like a couple of weeks after we vaccinated, everything went sideways. And the pediatrician told us that that's just a thing that happens, that, autism, springs up. Has nothing to do with the vaccines. And then they bring their second one in and their second one has the same problems. And they're like, yeah, it was totally normal. And then like a couple weeks after the vaccines, they started acting like this. And you're like, do you not see it? Or, well, I talked to the pediatrician And the pediatrician told me that they read all the research, and vaccines, don't have the ability to cause autism or cause any of these issues. She said the research is very, very, very plain and very, very clear on it. Again, these are pediatricians lying to their patients so they can get their kickbacks, because as we've shown, there's zero research on safety or efficacy for any vaccine ever. And this isn't new news. The Tylenol thing's not new news. The idea that there's no research proving vaccines are safe or effective is also not new news. The chiropractic community has been screaming it for years. It was a big deal when I graduated from chiropractic college in 2007. It was a big deal to us then, which is why if you go talk to a bunch of chiros, you're like, did you vaccinate your kids? They'd be like, no. Why? Because we know how toxic they are. We've been telling everybody how toxic they are for years, but no one wanted to listen to us. So there you go. But the other side is that when you're starting to bring these kids back, you've got to give their body all the tools and all the things it needs to build the brain. So we're going to have to make sure that they've got all the functionality to create ATP. Now, here's the thing. Even babies can go without sugars. Like, look at breast milk. Like, right, let's just assume that God knows what he was doing when he made breast milk. Is it a high sugar content or is it a high fat content? It's high fat. Now, what is your brain made out of? It's made of fat. So we need to increase the fat. We need to strip the sugars out of the foods we're feeding these kids, and we need to give them high fat, but specifically high saturated fat. Again, I know the medical community has told you for years that saturated fat's the biggest killer in the world. What they failed to tell you is that your lung surfactant is made out of saturated fat. The reason why we can breathe, made of saturated fat. Your brain, every cell in your body is made of saturated fat. Without saturated fat, you can't make your body. So without giving babies saturated fat, they can't heal, they can't regenerate, and they can't grow. Again, kind of interesting. All the things you need to be healthy, the medical community tells you not to do. Interesting. It's almost like they want you to be sick, taking lots of drugs. So we got to give these babies saturated fat. Again, this is why we like breast milk the most. If we can get other saturated fat forms into them, great. So that's one of those things. We got to rebuild the brain. Methylated folic acid, so that L-methyl tetrahydrofolate's a big one. Omega-3 fatty acids, that DHA, EPA, big one we got to get in. CoQ10. CoQ10's massive. We got to make sure that the body has the ability to create ATP. This is part of the electron chain transport system that helps your body make the ATP, makes the chemicals that make all the energy, all the function in your body happen. It's kind of it's the energy source that makes the body run. Think of it that way. So again, this goes back to when I'm all pissy about people talking about calories running the body, because that's not true. Again, from the medical system, the calorie system is from the medical system. So we don't want to go down that route. The other thing is that we got to radically increase glutathione. Now, here's the problem. A lot of people are taking glutathione. We have a glutathione product. If you want to take it, knock yourself out. I don't think that it's that beneficial. I think you should take the precursor, which is N-acetylcysteine or NAC. That's going to be your biggest option. It helps increase interstitial glutathione, which means that you're going to detox better, your babies are going to detox better, all of this stuff. So mamas, get that NAC in. That's probably the number one thing that would be beneficial. So this is always funny because they're like, oh my gosh, Tylenol depletes glutathione and we really need glutathione. And they just go on. They don't be like, oh, by the way, N-acetylcysteine increases glutathione. So this is why the other day when people ask me, like, what do we use? The Cellular Restore product, the Superior Cellular Restore, it has CoQ10 and it has NAC in it. And those two things are really important for detoxification, for anti-cancer. The reason they're anti-cancer is because they reduce reactive oxidative stress levels. So it helps with anything that has reactive oxidative stress problems. So cancers, arterial plaquing, heart attacks, strokes, dementia, diabetes, all those things. Helps with all that stuff. So getting that in to these kiddos is going to be really, really, really important. Sleep, super duper important. Make sure they're getting their sleep in. Again, we go back to minerals, selenium, magnesium, potassium. These are all really, really important. Getting them in. Boron, molybdenum. There's a bunch of them that we got to get into these kids. And here's the thing: the other side of this is that, well, why don't these kids have this? Okay, just go. Don't trust me on this one. Just go Google it. Google nutrient density of foods 2025 versus 1980 in U.S. And what you'll see is we have a substantial lack of minerals, vitamins, and nutrients that are in our foods today. So again, mom is the factory the baby's being built in. So if, let's say, this mom is 25 years old and she hasn't been getting nutrients for her entire 25 years of life, she doesn't have any nutrients inside of her, which is why we're having the depression, the anxiety, and the all the stuff these kids are dealing with. That's one of the big reasons. So she didn't have these nutrients when the baby's there, when the baby's being developed. And so now the baby's born and is obviously nutrient deficient when we're then injecting them with things that their bodies require nutrients to fight off. The other thing to bear in mind is that the liver, the detoxification pathway system that your body uses to clean everything else out, isn't developed in babies. The idea was that while they're in utero, mom's liver is going to take care of it. And then while they're being breastfed, mom's liver is going to take care of it. So they didn't need it. Well, if we're injecting things into these kids that they would never have naturally gotten exposed to, well, then obviously we're going to be creating problems the body wasn't designed to handle. And so that's one of these issues we're coming up with. So we've got to make sure that we're feeding the liver as well. And that's going to be all your methylated B vitamins, B2, B6, folate, B12, all super important. But we also have to make sure that the body has all the other cofactors it needs, which I've mentioned before. Cholesterol is also a big one. Your brain is made of cholesterol. Your whole body is made of cholesterol. Cholesterol is critical for all hormone function, for detoxification function. It's critical for creation of D3, which is also a hormone. It's not a vitamin. Again, pretty much everything you've been told about the body is a lie. Cholesterol is super critical for your heart and for your brain and for everything else in your body. All healing regeneration requires cholesterol. So we got to make sure these kiddos are getting quality cholesterol. Again, if we go to saturated fats and things like that, our body will be able to make the cholesterol we require. So these are a lot of the things that we're trying to work on in getting back into these kids. It is wildly easier to give it to mom while she's pregnant and mom while she's breastfeeding than it is to try to get into kids. You're not going to get a 2-month-old to swallow pills. And a lot of the nutrients we're trying to give them don't taste great. So they're not going to try to just suck them down in bottles or whatever. And then what we've seen with a lot of these sensory kids, a lot of these autistic kids, they have very high sensory acuity. And so they can taste things, you put a little bit of something into something big, and you and I can't taste it, but those kids can. So that's the other issue. So we've got to be able to figure out ways of getting these things in. So topicals are going to be great. There's a couple of homeopathics that work pretty well. Mixing it in food can help. We do that a lot. Changing their diet, though, is also a massive thing. So, you can give cookies and cakes and cookie dough and pie and all sorts of things. Just change the way it's made. Take the high glycemic sugars out, replace it with fats, and things like monk fruit and stevia and erythritol, and which is awesome, by the way. And people keep trying to dog on erythritol. Allulose is also phenomenal. Like those options, it's sweet, it's fantastic. It helps regulate functional blood sugar, so it helps increase insulin sensitivity and insulin functionality, which is, again, hypercritical to brain function, because remember, your brain communicates with insulin. Your brain makes insulin and then uses it to communicate, which is why dementia is such a big deal. So these are the ways that we kind of start walking these kids back. It's really, really hard. I'll just tell you, we're working on this because sooner or later, the parents realized it was the vaccines that caused the autism, and they're the ones that okayed the vaccines. And that's not a fun thing to watch somebody realize when they're in your office. That, because they always immediately were like, this is, they feel like it's their fault. And it's not. Their doctors lied to them. It's not necessarily their doctor's fault, because their doctors were lied to by the FDA and the CDC and the NIH and the drug companies and the insurance companies. So, the medical doctors should have known, the chiros have known this entire time. You can make the argument that a lot of the MDs did know, but they took the checks and they just got bought off, which I think is definitely happened. Because there are a lot of MDs who figured it out and just were like, no, my integrity and healing children is worth more than, $200,000, $300,000, $400,000 a year, because they wanted to help babies, not hurt them. So this is going to be the next thing that's going to come up is, how long did everybody know? Because again, this isn't something like, oh, no one knew. Oh my gosh, this is brand new research that no one had ever seen before. Remember, the chiropractic community has been screaming about this for at least since 2005, when I was going to school. So this has been a big, big deal. So at least 20, if not 30 years, the chiropractic community has been like, hey guys, this is a bad idea. We need to look at this. And we've been shut down. We've been marginalized. We've been sued. We've been killed, all sorts of stuff. So, this is thing we've known for a long time. We've known that our medical system has been intentionally poisoning these kids to generate, higher profits later. And, walk through that enough. The more you walk through it, the more you see like it happens at every single level. It's not one of those things where it's like, oh, we messed up here, but we got it these other 6 places. No, every single level we've messed up. And so at a certain point you go, this is intentional, but that's kind of where it is. So that's kind of how we treat it. If you guys are looking for people to treat them, that are taking new patients, Dr. Deborah Bain, Healthy Kids Pediatrics. And I believe that Shine, Dr. Randy Nadeau, is still taking complex cases and helping you guys out. The number one way to defeat autism is to not get vaccinated. Obviously not take things that deplete glutathione like Tylenol. Motrin's a better option. For fevers and stuff, I always loved colonic irrigations. It would break the fever instantly, and it was saline, and it helps kind of hydrate the kid and give more electrolytes and minerals. So that's the way that we did it. If the kid gets over 103, throw some Motrin at it, bring it down. But that's how a lot of this stuff goes. You're gonna have to recognize that what you've been generally told about health, about how the body works, about what's good for you and what's bad for you, it's all been a lie. It has been a lie that has been designed to keep you and your family as sick as possible, so that you have to keep going back to the doctor to buy new drugs and new tests and new things. Like, that's where it's at. That's what's going on. So, and I realize that every time I say that, people are like, oh, you're just angry conspiracy, person. Okay. Just, for someone who's been studying it for 20 years, it's the conclusions I've come to. So if you guys have any other questions, hit us up, questions@chalmerswellness.com, and we'll talk to you guys in the chats. You guys have a great day. Thanks for your time.